Good morning everyone. How many times have you faced such a situation where during the coding of a cardiac arrest patient, the monitor shows persistent pulseless ventricular tachycardia or ventricular fibrillation? Now, that is called refractory ventricular tachycardia or refractory ventricular fibrillation. So, the question arises, what is refractory ventricular tachycardia or refractory ventricular fibrillation? Refractory ventricular fibrillation or refractory ventricular tachycardia is defined as persistent ventricular tachycardia or persistent ventricular fibrillation despite of giving 3 or more shocks from the defibrillator, 3 doses of epinephrine, or using an antiarrhythmic agent like amiodarone or lidocaine. Today, we are here to show you 2 types of shock delivery to a patient who is suffering from refractory ventricular tachycardia or refractory ventricular fibrillation. Let's go. I have my staff here, Mr. Abhishek, who will be showing us how conventionally the pads are placed.
So first we apply pads how we used to do normally. Like if we give shock normally to the patient nowadays, like we used to apply one pad right side upper chest of the patient just below the right collarbone. Second pad we apply left side of patient on lower chest, that is apex of heart just below the left nipple. This is how we apply pads normally. Okay, for vector change defibrillation, we have to remove this pad from here. We'll apply this pad just below the left scapula, lateral to the spine.
After placing these pads, we will be selecting to 200 joules in the defibrillator here.
Check pad.
Now, please give charge.
Check pad.
And deliver the shock.
200 joule ready. All clear?
Clear.
Shock given.
This is how we give vector change defibrillation in a patient with refractory ventricular fibrillation or ventricular tachycardia. Now, we will be demonstrating to you another technique of shock delivery in a patient of refractory ventricular fibrillation or refractory ventricular tachycardia. This technique is called dual sequential external defibrillation. The requirement of this technique, sir, we would need 2 sets of pads, we would need 2 defibrillators, and to run this process effectively, it's better to have 2 staffs. So, we will be demonstrating you the pad placement in this technique.
So one set of pad will be applied normally as we applied in normal defibrillation. Like one pad right side upper chest just below the right clavicle. Another pad left side apex of heart just below left nipple.
Now we will be using the second set of pad. The first pad, which is supposed to be applied over the apex of the heart, will be applied over the left side of the chest above the previous pad as close as possible but not touching each other. The second pad would be applied as we have done it in the vector change defibrillation. Here I am doing a log roll for him. This pad would be applied just lateral to the spine and below the scapular region. After the placement of the pad, we would select 200 joule in the defibrillator here and press the charge button together. Now we will be giving shock to the patient at the count of 3, 2, 1. Shock has been delivered to the patient. This is how we deliver shock in a dual sequential external defibrillation. One of the recent study has shown that Using of dual sequential external defibrillation in an interval of less than 75 millisecond is associated with reversal of ventricular fibrillation and achieving of loss. One of the most discussed cluster RCT is dose VF, which was done in 2022. This study showed that using of dual sequential external defibrillation, the survival rate is 30.4%. Using of vector change defibrillation, the survival rate is 21.7%, and using the conventional care method, the survival rate is 13.3%.
So next time when you have a patient with refractory VF or refractory VT, do not forget to use these techniques of giving defibrillation shock. So one is vector change defibrillation, another one is dual sequential external defibrillation. Thank you.